Good afternoon, everybody. Doug McGowen with the City of Memphis, representing the Joint Task Force of Memphis and Shelby County, joined today by Dr. Taylor from the Shelby County Health Department. I'll start today and cover a bit of information about our hospitals and where things stand there, get into testing and capacities for additional testing, and then cover vaccinations. Then I'll turn it over to Dr. Taylor. We've reached an unfortunate milestone here in Memphis and Shelby County in our region. We have surpassed the highest number of COVID patients in the hospital and the ICU this week. We have more than 700 people hospitalized with COVID-19. That is an unfortunate milestone, but something that we saw based on the increased case rate that was happening. Most of the people in the hospital are unvaccinated, and of the 1,800 people or more that have unfortunately passed away from COVID, less than 1% of those were vaccinated, meaning 99% of the people were unvaccinated. Our hospitals are doing an admirable job balancing all of the demands, given these very unfortunate circumstances. We have received some help. We have more than 30 National Guard medics who have arrived on scene and are helping an array of hospitals. Most of our systems have medics there. Others have requested those medics, and some may be on the way arriving later this week. So 30 medics and about 30 administrative personnel. That will allow our hospitals to maintain and keep open some additional rooms. It will also help with their capacity to administer and infuse monoclonal antibodies, which if you've been paying attention to the news, is one of the treatments that can keep people from being hospitalized, and so that's an important part of our strategy as well. So we will provide more updates to you as we get them, but all of the requests for support have not yet been fulfilled, and we will advise you whether we can actually meet all of those requirements. But for now, we do have help here, and it is helping with our capacity, and not just in Memphis and Shelby County, but our partners down with our healthcare systems in Mississippi have also received some support, which is helping them manage the caseload. It doesn't mean we're still not at a critical state. We have a demand signal from the hospitals for our volunteers, and these are typically our medical, nursing, and respiratory students who have stepped up to the plate to say they will take on a shift, they will help extend care, and we're very thankful for the institutions of higher learning who have allowed their students to step up and help with care for patients in the hospital. So things are continuing to increase at our hospitals. They are not showing signs of slowing down yet. When our case rate begins to come down, you could expect the hospitalizations to be 2 to 3 weeks behind that. So any diminution in the number of new cases will not be followed by any change in the hospitals for 2 to 3 weeks. We move on to testing. We talked a little bit last week about the increased demand for testing for a variety of reasons. And so we understand that people have struggled to get access to testing. In the public sector, we are expanding our capacity to deliver testing. There are 3 sites where we are doing that. At Poplar Healthcare on Hacks Cross Road, we are working with them to add an additional lane, which we anticipate will be up early next week, so they have a little higher throughput. At the Lamar Avenue Inspection Station, which is actually on RKS Commercial Cove, there are 2 lanes operating now. We think by the first part of next week there will be a 3rd lane, which will be a 50% increase in our ability to provide testing to individuals. And then we'll be adding a new capacity at the South 3rd Street location for Christ Community Health Services. At the South 3rd clinic that they have, they'll be bringing on capacity in partnership with the Shelby County Health Department to add significantly more drive-through asymptomatic and symptomatic testing capacity. So all of those testing locations can be accessed through covid19.memphistn.gov. Remember, there are also available tests at many of our private partners, Walgreens, Walmart, CVS, and other pharmacies and clinics throughout the area. So please go. You can schedule one, and there are several that have just drive-up capacity for you to get tested. So by early next week, look for more capacity with testing. I'll move on to vaccinations now. We've administered here in Memphis and Shelby County more than 825,000 vaccinations. That's 49% of our population has received at least one, and 39% has received a full course of vaccinations. They are free. They are available for you and your family. The Pfizer vaccine was recently received full FDA approval for people who are 16 and older, and that is good news for people who are waiting for that full approval. So if that's what you're waiting for, come on out and get your Pfizer vaccine. We are also preparing for booster phase vaccines. For people who are immunocompromised, you may go to a public vaccination site and receive that booster vaccine of Pfizer. And we are preparing for ultimate approval by the FDA and the CDC for booster shots for everyone who has received a vaccination or a full course of vaccinations. We expect that will happen mid-month next month. And so we will be prepared both at the Pipkin site, which we plan to keep open through the winter, and also at the Germantown Baptist site, which our friends in Germantown and Collierville have willingly stepped up to the plate to provide another high-volume vaccination site. Not online yet. We'll let you know when it comes online, but they will be ready and able to help us with vaccinations early next month. Our communication strategy has continued since we began this. We started our door-to-door campaign in May, and since then we have knocked on 20,000 doors. We have called via our phone bank more than 60,000 households, and we have had people, more than 100 people through our door-to-door campaign take a vaccine on demand. The Vaccine on Demand program will be coming to a close at the end of this month. Frankly, we are preparing ourselves for that uptick in boosters and an uptick in demand for vaccines now that the FDA approval has been received. And so this is your opportunity through the end of the month. If you're down in the South Memphis, Westwood area, and we're offering vaccines on demand with our door-to-door campaign, please take advantage of that because we will be bringing that to a close at the end of this month so that we can provide more broad-ranging vaccines as demand picks back up. Again, if you need a vaccine, you can go to covid19.memphistn.gov and find out where you might be able to get one of those vaccines. So with that, I will stop my comments and turn it over to Dr. Taylor so she can have some comments.
Thanks, Chief McGowen. Here to give the COVID update for today. Total cases in Shelby County as of August 25th, 122,041. 7-day average of cases per day, 744. Active cases, meaning those people tested within the last 14 days and found to be positive, 8,517. And the 7-day average test positivity rate is holding steady at 21%. The effective reproductive number, or the RT number, meaning how quickly the virus is spreading in our community, is 1.13. Total pediatric cases, 18,212. Pediatric active cases, 2,767. And percent of all active cases that are pediatric cases, 32.5%. As Chief McGowen shared, we actually broke records for hospitalizations twice in the course of 7 days. Total hospitalized as of yesterday was 701, with 515 acute cases and 186 patients being cared for in the ICU. The last time we were this high for total hospitalizations was January 6, 2021 at 661, with acute cases that same day being at 497. And the last time we were almost this high in ICU was December 21st, 2020 at 180. I have a few slides to share that will just give you the picture of the numbers that I just shared. The first slide shows that we continue to rise in hospitalizations. Every portion of that blue shows when patients were admitted for COVID-19 in our county. The next slide shows the admissions to the ICU in Shelby County. And the next slide shows that as of August 25th, our active cases among patients 0 to 17, our pediatric population, has surpassed the number of active cases in our 18 to 24-year-olds and our 25 to 34-year-olds for the first time. For comparison, you can see at the left is the bar graph from August 19th. Finally, last slide is the slide showing our goal in the county. Right now, for residents that have initiated their vaccination series, we are at 48.7% of the population, and as a percent of the total population who has completed vaccinations, we are at 38.6%. As Chief McGowen shared, and I will reiterate, the Pfizer vaccine has received full FDA approval, and we are anticipating that in addition to immunocompromised residents of Shelby County being now eligible to receive an additional dose of the COVID-19 vaccination, we are anticipating that soon the booster dose for people who have completed either the Pfizer or the Moderna vaccine series will be available soon. With that, I will open up for questions.
Michaela Watts, Commercial Appeal.
Good afternoon. Dr. Taylor, I have a question about pediatric admissions at Le Bonheur. A couple of weeks ago, Dr. Nick Highsmith signaled a tepid level of optimism and expressed that he hoped we were seeing those cases level off. With what you know about hospitalizations among children, is there any sign that that's happening? And I'll have a follow-up.
Great question, Michaela. Right now, we are at, for pediatric hospitalizations, we have 28 total, 7 in the ICU, 21 in acute care, and that's as of August 23rd. Right now, what we're seeing is that pediatric patients are still being admitted for COVID-19. As far as a leveling off, I'll have to get that information for you.
Great. Thank you, Dr. Taylor. And as a follow-up, I wanted to ask a clarifying question about the HERTS data that we view on the Shelby County Health Department website. When we're looking at the capacity, are we looking at just a raw number of hospital beds, or does that number reflect what hospitals are capable of staffing? Like, does it reflect nurses as well?
So I'm going to try to answer this question, but I believe that it reflects what hospitals are able to staff at this point. Like Chief McGowen shared, we do have some hospitals that have requested and received National Guard assistance to be able to staff even more. But when you see the capacity, the way that the hospitals report is the capacity based on what they are able to staff.
Kelly Roberts, WMC.
Hey there, I also have a question on pediatric hospitalizations. You know, when we're talking about adult hospitals and capacity, I know we talk a lot about, you know, few beds remaining, the staff shortages, bringing in federal help to help open up more beds and staff more. Are we at a point where we're seeing the same capacity issues in pediatric hospitals, say at Le Bonheur? What does the strain look like in the pediatric hospitals right now in comparison to what we're seeing in the adult hospitals?
That's a great question. The last time I spoke with our partners at Le Bonheur, I know that there was a strain, but they still had capacity to see the patients that were coming in with COVID-19. Now, with that said, pediatric hospitals are a little bit different. They tend to not see as many sick patients because by and large the pediatric population is pretty healthy. But what I will tell you is that in addition to seeing positive COVID-19 pediatric patients, they are also seeing an uptick in other pediatric conditions right now, which is giving them more strain. So they're seeing more cases of RSV, and as you know, we're going into flu season too. The numbers that they are seeing right now usually don't happen until the winter time, but they're seeing those numbers now in August. So if you're looking at a comparison between now and what they would normally see in the winter, then in that way, they are strained, but they still have capacity to see the pediatric patients that are coming in. Do they want to have to do that? No, because we know that COVID-19 is making pediatric patients sicker and is requiring hospitalizations for pediatric patients in a way it wasn't at the beginning of the pandemic, and that's concerning.
Thank you. And my follow-up is regarding any investigation on clusters inside Shelby County school districts. Can you say how many clusters you are, or the department is investigating in what districts of the county at this point?
Great question, but I cannot say, and I will tell you why. So we work very closely with all of our school districts to make sure that we're investigating any potential clusters, and we rely on our school districts to help us with case investigations and contact tracing. As you can imagine, when we're talking about information on minor individuals, the information is very sensitive. And we rely also on our state partners to help us report that data reliably, but also aggregate that data in a way where we wouldn't be singling out a single school, a single classroom, or in some cases even a single school district. I do know that some of our school partners are already telling how many cases they have within their schools, and we believe that that's the best way to protect the information of our school children while still making sure that we are investigating cases and contacts appropriately.
Jane Roberts, Daily Memphian. Jane, I believe you're self-muted. Shay Arthur, WREG.
Hi there, hope you're having a good afternoon. I just wanted to circle back to the comment made at the beginning of the briefing about those monoclonal antibodies and saying, it's an important part of the strategy in fighting COVID-19. Is there any plans to have more places to offer this service or get the word out more to people about that this is available?
I'm going to defer that one to Chief McGowen.
Thank you. It's a good question. Yes, there is a plan to expand. I know all of our hospital systems who are offering this have recently increased their capacity by about 50%. And so there's a referral process that happens from the ordering physician to order somebody to get those infusions, and largely they're based on people who have the highest need, people with underlying conditions. There is also some new capacity coming online. We are working with our partners at the University of Tennessee Health Science Center and Regional 1 to begin offering some capacity there. We're not ready to schedule the appointments yet, but we'll begin this week and with hopes that we can ramp that up. There have been mass infusion sites established in some other states. Largely this has been state driven. We do not have one yet driven by our state here, but we are doing everything we can to ramp up capacity to serve individuals with monoclonal antibodies, and our hospital systems have been pretty intentional about that. And again, as I say, we are looking to expand that capacity on a small basis to begin this week with Regional 1 Health and UT Health Science Center, and with hopes that we can increase that capacity significantly in the coming weeks.
Great, thank you. And then you can probably just stay right there because a second question for you. I know it's pretty soon since the FDA approval on the Pfizer vaccine, but have you seen, with the Pitkin building opened yesterday. Did you see a greater number than before? Have you seen kind of an increase since that approval? Thank you.
Well, I think it's hard to say what was causal to the increase. Our average has been ticking back up week by week. I hate to look at any one particular day, and it's been pretty quick since we had the FDA approval, but I'll look for that trend to increase over the next few days and the next few weeks. Clearly, we know that was one thing that people used as an objection, is that it was not FDA approved. Now that it is, we're hopeful that people will get over that objection and come on out and get vaccinated. So it's one more tool in our toolbox to convince people that vaccinations are safe and effective, and I think the data bears that out.
Hannah Grabenstein, MLK 50.
Good afternoon. I have some testing related questions. I know you mentioned increased capacity at some of the community test sites, but even with increased capacity, I'm still hearing from people who are seeing really long turnaround times for test results, 3 days, 4 days, 5 days, a week, maybe not hearing back ever. And I'm wondering, is that something that can be addressed, or how, on average, how do you feel about the test turnaround time?
So it's a pretty general observation, but to get down to the solutions for any particular long delay, I'd have to know the details. In general, our laboratories and our partners have been doing a very good job of turning laboratories around in less than 24 hours. There have been cases where I know that it's been 24 to 48, and I know when you go to our drive-through sites that they put on the information that they will try to get that to you in less than 3 days. So there are a number of laboratories that are doing the testing. There are a number of systems in place for notifying people. I wish I could tell you that I had a universal system for everybody to register, a universal system for notification, but there are varying systems that are being used depending on the provider. Walmart, Walgreens, CVS, they have their own systems. Christ Community Health Services uses a specific system. The folks at Poplar Labs have a system. There is not one universal standard. The demand and the turnaround time typically are coincident with, they're directly proportional. So if there's a huge demand for testing, a huge number of tests, it may take slightly longer. I have not heard of the 5 to 6 to 7 day turnaround. I have heard the 2 to 3 day turnaround, but if you would share with me specific instances, I will certainly look into that and see what we can do to try to drive that number down, because clearly we're asking people, if they are symptomatic, to get a test and then isolate until such time as they get their results. For asymptomatic people who just choose to know their status, it is also a waiting game, and we understand how important that is to get a result back quickly. I know that our lab partners are committed to do that in under 24 hours. And in most cases, they're able to do that. But if there are specific stumbling blocks or specific examples that we can help with, please let me know what those are.
Sure, I can follow up with you. My second question is also on testing. I guess I'm having difficulty finding the week over week numbers, but when we're looking at it holistically, are we at a point in the pandemic where we are doing as much testing as previous surges, or greater testing than previous surges?
So I think the numbers will come back up. As you recall, in previous iterations, we had been doing some mass testing with the schools, and some of that is starting again. So it's hard to compare apples to apples because it's quite different conditions. In addition, many companies are offering testing. Early in the pandemic, there was quite a bit of testing that was done by the public sector because it just was not available. You'll recall there was a lack of reagents, there was a lack of swabs, there was a lack of, just basic equipment to do the tests. And so the public sector held most of that and was doing most of the testing. Today, many companies have individual access to doing the tests, so it's very difficult to compare. I would suggest that given the number of cases that we're seeing, the number of results that we're seeing back, remember those are only coming from what is entered into the system, and we're not sure where other results may be coming from, but it's hard to compare apples to apples with the difference in circumstances. I will say that it's impossible to do enough testing frequently enough in a pandemic in the scale and scope of what we're seeing today. So we would always like more capacity. We would like to be able to test people more frequently than we are today. And I guess that's where I'll leave it.
Jane Roberts, Daily Memphian.
I noticed that the second amended order is going to expire August 31st, and while we expect it will be renewed, is there anything to say about if it could be stricter or what the renewal will look like?
Sure, I'll turn that over to Dr. Taylor.
Thanks for the question, Jane. So for right now, yes, it will be renewed. And for right now, it will not be stricter. So we have put in language saying, yes, there is a countywide mask mandate for indoor public spaces, but we are also highly encouraging people to wear their masks even outdoors if they cannot safely social distance and or they know they're going to be in large crowds. For right now, we are counting on everybody in the community to understand that we are still at a critical point for our hospitals and for Shelby County, and we need to make sure that we're doing everything possible, meaning masking when at all possible, meaning getting vaccinated if we are eligible to be vaccinated, and making sure that everybody is on the same page about how critical this is to make sure we're keeping as many people healthy and safe as possible.
Thanks, Dr. Taylor.
Thank you.
Those are all of our questions today. Are there any closing messages from any panelists?
I would like to reiterate the idea that, remember, we have vaccines in the community available for everyone who is 12 years of age and up. Chief McGowen has said it, I have said it, you've heard it. Please, if you are eligible to be vaccinated and you've been on the fence, but you're hearing the news and you hear what's going on in our hospitals, make sure that you go to a trusted health provider or to one of our mass vaccination sites and get vaccinated. And in the meantime, please be wearing your mask, especially in indoor public spaces, over your nose and mouth. And if you cannot safely social distance outside, or you know you're going to be in a large crowd, make sure you have your mask on. Everyone's health depends on it, and we're counting on everyone in the county to help keep everyone safe, not only individually and as families, but as a community. Thank you.
Thanks, everyone. Have a good weekend, and we'll see you back here next week.